Welcome. I'm Mayor Connie Boyer, and today we are going to give you an update what's happening in Fairfield and Jefferson County on the COVID-19 emergency planning. And I really appreciate this group up here coming today to give our citizens good information and tell you what's happening. So I'm going to let each person introduce themselves and their part in this, and then we'll get started.
Thanks, Connie. Hi, everyone. I'm Chris Estle. I'm the Jefferson County Public Health Nurse Administrator.
I'm Brett Ferrell, Jefferson County Emergency Management Coordinator.
I'm Daryn Hamilton. I'm Jefferson County Supervisor, Chairman of the Board.
I'm Bryan. I'm the CEO at Jefferson County Health Center.
And I'm James Trent. I am the Medical Director for Jefferson County Public Health.
Thank you, everyone. We're going to start out with Chris. Go ahead.
Well, as of this morning, Jefferson County has had a confirmed case of COVID-19. That is the first lab confirmed case that we've had since this epidemic has started. I will say that we've had symptomatic individuals in Jefferson County for several weeks now that have been under home isolation and quarantine based on their signs and symptoms of illness. And I want to remind everyone that a positive or negative test is just a snapshot in time. That doesn't mean that you won't go on to develop symptoms and maybe become positive. So that is just a snapshot at that point in time when that test and when that specimen is collected. I also want to remind everyone that specimen collection and testing are two separate things, and Bryan will probably speak to that later during his portion as well. But again, just remember that specimen collection and testing are two different things. I just want to kind of give a quick overview of some things that we've been doing, and then I'll let everybody else talk, and then we'll kind of come back to what we know. I cannot stress enough the importance of individuals performing good hand washing, good hand hygiene, staying home unless you're an essential service worker, limiting your trips to the grocery store or to, any other place you may need to go. Only sending one person for groceries or essentials. It's not an outing for the whole family. I did see one business say one cart, one person, and I really kind of like that logo or slogan to remind us all we don't need to take 6 people to Hy-Vee or Walmart to get necessities. I understand everybody feels as though they're being held hostage in their own homes, but it's the only way that we're going to get ahead of this virus and to mitigate the spread, meaning stop the spread and stop community spread and decrease the numbers of individuals that will be symptomatic. From the health department side of things, we've been participating in webinars, weekly webinars, sometimes 2 or 3 times a week since the middle of February. This has been on public health's radar since January. We've been working with all community partners specific to COVID-19 since January when we were watching what was going on in China, and then we've watched this virus progress across the world. We've had numerous meetings with healthcare providers, with our community partners, including fire, law enforcement, EMS, emergency management, schools, daycare centers, our college, and know that all of those entities, nursing homes, assisted living, know that all of those entities are very much making the safety of their workers and their residents or providers or their patients that they care for a priority. I want to talk a little bit about how a communicable disease follow-up works. COVID-19 is a communicable disease, as are other diseases that local public health departments are responsible performing communicable disease follow-up with. So the disease, a confirmed case will be reported to the local public health department for that individual's county of residence. So I live in Jefferson County. So if I were to test positive and I had a test performed either in Fairfield, a different county, it would come to my home county, my county of residence. So it doesn't matter where you work, it doesn't matter where the test was obtained or specimen was obtained, it's going to go to your home county of residence. So your local public health department in your home county of residence will be responsible to do the disease follow-up on this COVID-19. We are currently in the process of performing the communicable disease follow-up on the confirmed case as of this morning. This individual is in home isolation and they are not currently experiencing any life-threatening types of illness or problems. They are an adult between the ages of 18 and 40, And with that, the household contacts are the first ring of communicable disease follow-up. So all the household contacts with this individual would be under 14 days of isolation and home quarantine. We at the local health department will be monitoring temps daily. So the individual will call us and report their temperature for the day, and then we'll send that information on to the state. A couple other things, and then I'll turn it over. We've had some childcare questions, and I know that the Department of Health and Human Services and the Iowa Department of Public Health sometimes have differing guidelines. It was made with the support of my Board of Health, Dr. Trent, the county attorney, emergency management. When schools were closed, I decided with that support and input from those individuals to close a community child care center. We'd had contact with Colleen Bates, who's that community child care center director, and we felt it best for the safety of those kids and the daycare workers to close the child care center to decrease the number of kids that are going to be going from school to a center type of a situation. And we know how kids like to share things. We know how close contact kids are, and we wanted to decrease that spread. Oftentimes children are carriers, meaning they're asymptomatic, not always, but oftentimes. So they may not show symptoms of illness, but they could be spreading illness without anyone knowing it. Let's see. And Dee Sandquist requested, she's one of our supervisors, requested that I make a quick comment about homemade masks. I know the health center is working with community distribution on that. And so you can, if you're making homemade masks, we do have a pattern that's a preferred pattern. You can let us know at the health department or our hospital. If you want to let us know, we can get that information to you. I just touched my face. I'm trying to make a cognitive awareness of how many times we touch our face. We got to keep our hands away from our face. So if you need the mask pattern, we're happy to send that to you. You're welcome to drop masks off at the health department, and then we can coordinate that with other entities that may be providing direct patient care. I think that's all on my note card at this time. I'm sure we'll come back around. So Brett, I'm going to turn it over to you. Thank you.
Thanks. So I guess I just want to start off by saying, Jefferson County Emergency Management is currently supporting public health through this whole thing. And the way we do that is by pushing out information, sending the same information out, the correct information on whatever platforms we can. And then we also will acquire state resources when needed, including PPE and personnel. But kind of how this is developed for us, we do have a comprehensive plan in Jefferson County, like most counties do or should. We have been in planning stages and preparedness stages, and with different exercises and training over the years with local partners. Obviously not to this scale, but we do have a plan in place, which is there's a bunch of pieces built into the overall plan. And I'm not going to go into detail with everything, but I will tell you that, first of all, when Chris and I, we talked about a little over 3 weeks ago, and we said we're going to open up our EOC. And what the EOC is an emergency operations center, where it's one site, one overall command, and then all the information goes through that EOC, and it's also our joint information center. So all communications go through the EOC. We have daily communications on the local level with several frontline resources, including the hospitals, board of supervisors, attorneys, Dr. Trent, the mayors, and we try to get all that information in and develop what our plan is for the day for our hit list for tomorrow. So it's basically a war room, and luckily we do have the partners in this county that work well with each other, and everybody wants to help. But some of the things that come out of there, we have a daily press release, and then also that press release, I also send out daily information in the afternoon to the mayors within the county to let them know, get the same information out to them. Part of our plan includes what we call our emergency support functions, and there are 15 ESFs, which is what we call them. And with this pandemic, most, if not all of those ESFs are active right now. So public health is ESF 8, and obviously Chris is in charge of that, and we are at the EOC working on all those ESFs. We have passed down some of the other ones to to incident command through ESF4 is fire. We've passed that down to all communication goes to our local fire chief, Scott Vaughn, and he passes that information out to the other fire departments and first responders, the critical information they need concerning anything from PPE or anything else. The law enforcement one, they have their own command, and they bring us information, and we also pass information down to them. So the support functions are critical, that everybody's doing their job. The last thing I want to say is, we get a lot of requests for PPE, personal protective equipment, and we are currently working on that. And everybody, I think, gets this false information out there that, we can get anything we want. That is not true. The resources are tapped to the max right now. I will say that we got on it early, and I ordered some personal protective equipment for the hospital, JCHC. We got gowns, masks, and stuff like that came on a National Guard vehicle. And then we got our second shipment, partial shipment yesterday that also came in the hospital. So we are preparing them. Obviously, in my world, we think worst case scenarios. So we are making sure that we're getting that to them. If it comes a time when they need state resources such as personnel, we will also make that call to the state web EOC and request that. So if you see any National Guard vehicles coming in the hospital, that's probably, don't panic, it's probably just personal protective equipment at this point.
On behalf of Jefferson County Health Center, wanted to provide an update of all the activities that we have been engaged in to address reducing the spread of COVID-19, but specifically to first share with you the safety measures that we have in place, also to share with you our current testing and treatment capabilities, and then finally to kind of share with you some of our contingency plans for possible scenarios. But before I start, I really wanted to just share appreciation for our COVID team at the hospital, helping lead the planning and the discussions of how we can tackle this and address it. Dr. Greiner, Stacy Worley, Shirley Atkinson, Curtis Smith, Jackie Buchanashbish, and Jessica Jones are our main group, and they've put in tireless effort to stay on top of the guidelines that are ever changing and to make sure that we're prepared. Also appreciate the rest of our medical staff and our healthcare workers. They've done a remarkable job under this pandemic. COVID-19 has certainly turned upside down a lot of things in the world, and healthcare workers are not immune from that. And it really cannot say enough about the staff that we have there. I also appreciate Chris and Brett's partnership. They've been a great support for us and very willing to help and support the hospital, and we really do appreciate them. And then just the outpouring of the community support. We've gotten a lot of local businesses and community members who have reached out and to offer support in any way that they can. That has been in everything from homemade masks to face shields to aerosol boxes to pizza, hearts in the windows. And I just really want to make sure you understand how much we appreciate that community support in what we're going through on a daily basis. And then finally, we really appreciate the community members and patients who are dealing with the restriction that we have in place for the screenings they have to go through when they visit the hospital now, and again, their visitor restrictions. So as far as safety measures that we have in place, there are quite a few. Some of them have been in place for quite a while. Some are newer. They do change frequently as updates from Iowa Department of Public Health and CDC come out. And so if I say something today and it's different tomorrow, you understand that it changes, and we're evaluating this every day. But it is the top priority for us to protect our patients and our staff. And so one of the things that we feel is important for us to do is try to share as much information as we can for the community. About 2 weeks ago, we established a COVID-19 hotline for anybody to contact, a local resource that you can ask questions if you feel you have symptoms and need clarification on something. You can call in. We can have nurse help get you answers and help know what to do and how to move forward. That has, again, been in place for about 2 weeks now and has handled about 402 calls as of yesterday. And so it is being utilized, but we want to make sure that that is a resource for the community. almost on a daily basis, we've also been providing updates on our website and on Facebook to try to share, again, as much information as we can about what's going on at the hospital, but also some good hygiene and home practices to reduce the spread as much as possible. So I would also just refer you to our website and our Facebook account for additional information. We also heavily utilize the Iowa Department of Public Health and the CDC website and their guidelines. We are under visitor restrictions. We do encourage that if you have an appointment, that we'd ask that you come by yourself if possible. If you need assistance in the transportation, we'd ask that you would eliminate or limit it to one support person with you. We also are screening all individuals that are coming into the hospital. That includes all staff, all patients, all visitors, and all vendors at this point. Staff go through getting their temperature taken, go through a series of questions, and if they have a fever of 100 or greater, we're sending them home. If there's other triggers, they will be required to wear a mask. There are other questions for patients and protocols that we have in place that if they hit certain triggers, that we will move them into certain predetermined rooms to help reduce the amount of proximity to other patients. And then visitors, if they have anything of a cough or fever, exposure to a positive COVID, we're asking them to not come in. A few of the final things, safety-wise, we've also established an isolated area for suspected COVID patients that if we know ahead of time, we'll direct them to that area to help reduce the combining them in our normal public areas in the hospital. This includes protocols for that area for the protection of the patients and the staff. And we also have contingency plans that if we were to need more space, how we can expand that and still keep as much containment as possible. We have put on hold all elective surgeries at this point. We still are performing emergent surgeries so that in the event in the community there would be a need to have a surgery performed in a timely manner, we are still capable and able to do that. We have reduced the number of clinic appointments that are going on, and then we are daily watching new recommendations and guidelines, again, from the CDC and the Iowa Department of Public Health, and monitoring what we're seeing at a local level also of how we can improve and continue to provide safety for our patients and staff. I know that testing is an area of interest, and wanted to just share some things that we're doing on a testing level. JCHC is able to collect samples for testing. The number changes daily, but at the last count we had, which was end of the business day yesterday, we had 80 test kits. And as reported on media outlets, there is a shortage of test kits. And so we are not able to just order the amount of supplies and kits that we would like to have. And so we are working with the number that we have. I know nationally they are working to increase the production of test kits, and I know that they have been able to do some of that. However, currently we just are not able to get the kits, the amount of kits we want, because a lot of them are going to the hot topic or the hot spots in the country. Whether a patient receives a test is based off of the state hygienic lab criteria. The criteria focuses on the most at-risk population. Once the sample is collected at our facility, it is sent to the state hygienic lab or to our reference lab that we have an agreement with for the test to be run. These tests are a 95 to 99% accuracy rate. Results from the state hygienic lab take about 24 to 48 hours for us to get the result back. The reference lab that we work with takes about 5 to 7 days for us to get those results back. The lab then notifies JCHC of the results, and we contact the patient and provide education and options and treatment recommendations. Regardless of the results and regardless of whether the test was done, JCHC is contacting suspected patients daily to monitor their symptoms and to ensure we're aware of whether they're improving or whether they're worsening. As of April 1st, JCHC had collected a total of 65 tests. There was one positive, but it was for a resident who lived in a separate county. We had 41 negative tests and 23 pending tests. You may, if you're trying to reconcile public health and our numbers, sometimes the reporting criteria are slightly different. Sometimes they're reported based off of residency or where they live. And we see patients that would be outside of the county sometimes. And so we might have a positive that isn't necessarily being reported from the Jefferson County. Those changed, and I'm sure what I reported as of the end of the day yesterday are already different. But we'll continue to, we started earlier this week to add those numbers to our website. So those who are interested in watching those numbers, it's available there. We update it at the end of the day, and we'll continue to do that. I would echo what Chris already mentioned, though, is I wouldn't be quite as concerned as the amount of tests or the positive or the negatives, but understand the guidelines that are being asked to follow being the best way to really reduce the risk. We are working and in the process of adding the ability to perform the test at JCHC. Our start date is unknown, but with the number of requests for hospitals to add testing, you can imagine that we are on a wait list basically, and we really don't anticipate being able to start until at the earliest probably mid-May. The test that we would be adding also would be at a 95 to 99% accuracy rate. As far as the ability to provide care, if a patient's condition requires hospitalization, we will continue to assess whether we can treat patients here or transfer to a more appropriate setting. That will continue to go on. But we are prepared to admit patients to the hospital and provide the care they need. Ventilators may be used in the treatment of COVID-19 patients. We have 5 ventilators that are available to us that may be used. Our plans include isolation of the COVID patients from the rest of the inpatient wing to provide as much separation as possible. We also have protocols and treatment and appropriate personal protective equipment for staff. And we're even evaluating things like airflow, delivery of meals, and cleaning procedures. As far as future scenarios, there are several unknowns for the future. So we are planning several contingency plans. Some of these scenarios include plans for caring for several patients diagnosed with COVID-19. Another plan consists of handling a large spike in patients diagnosed with COVID-19, and which may require the need for more than our 25 bed capacity that we have today, and how would we accommodate and deal with that scenario. We're also making plans for shutting down clinics and how we would continue to provide care to patients who need to have ongoing, whether medication refills or care, and keep that going moving forward. We're also making contingency plans for how would we house staff if they're unable to go home. And you can imagine there's other scenarios, but those are kind of give you a sample and some ideas of the scope of things that we're trying to really be prepared for. I've been asked in the community my view of the COVID-19 pandemic, and simplest way I can say is I think it's unnecessary to panic. I think it's not appropriate to think it's nothing. But I think it's very wise to follow the recommendations and guidelines that would reduce the spread. These recommendations, which I think Chris has alluded to earlier, would be to stay at home as much as possible, to practice good social distancing when you have to go into the public, to practice good hygiene frequently, and if you have symptoms, to call the hospital before coming in so we can start the monitoring and helping be a support to you as you go through those symptoms. And so finally for us, we will continue to evaluate the situation both regionally and locally. We'll continue to monitor and provide safety measures for our patients and our staff, and to update those as new updates come out. And we will continue to provide testing, collections, and care for our community, and continue to plan for future scenarios so we are prepared for what may come. Thank you.
Thanks, Bryan. At the outset, I want to say that it's been a pleasure to work with Chris Estle as our public health administrator for the county, and also with Brett Ferrell, who's working with emergency management. I've had a great opportunity the last 3 weeks to be able to work with these individuals, and I'm glad to say that the county is in good hands with these individuals that are working for the county tirelessly, and I'm thankful for being able to work with them on a daily basis. There may be times that we don't see each other necessarily on a daily basis, but indeed we're able to keep in contact with one another, and we're very fortunate to have these individuals that are working for us in the county during this very unusual time. Now, these are unusual times. None of us here have seen a pandemic like this before, so sometimes it feels like we're breaking new ground, and so it becomes a bit uncertain in terms of how things are going to go in the future. To be frank, none of us really know what's going to happen in the future. We can see what other countries and even states in our own country are going through at this time, and so it really behooves us to be able to act appropriately, plan ahead, and plan for the worst, unfortunately, because we just don't know what's going to happen. Sometimes we get asked, how many cases are we going to have? How and when is it going to spike in terms of the number of cases? Frankly, we don't really know when that is going to happen. It will say, though, over the next couple of weeks will be critical in terms of what happens here for the county and for the state of Iowa in terms of what's going to happen with the number of COVID-19 cases and how this is going to play out. So we try to do our best in trying to plan for these kinds of things, and contingency plans are in place, and we've all been working together in terms of trying to do our best to anticipate what may happen, although it is very difficult. The majority of patients that will contract COVID-19 will be indeed mild cases, maybe asymptomatic cases. About 81% of these people will be having mild case symptoms. Could be manifest itself easily even as a cold or something. It would be very severe, or would not be very severe. You have about another 14% that are going to develop more severe symptoms, shortness of breath, et cetera, that might be more severe in terms of their symptomatology, but are not requiring necessarily having to need a ventilator, as Bryan was just talking about. And yet about another 5% from what we see develop critical or become critically ill and will need ventilator support. And as you may see in the news media, there's a lot of discussion in terms of how those needs of those patients are being met. So if you look at overall, about 5% of these patients that develop COVID-19 or contract it will need critical or intensive care unit types of support for that for them to get over the illness. Our numbers are currently low. As Chris has just mentioned, we've just had our first positive case, confirmed case here in the county. But as you may have seen, it's in either the governor's press conference or elsewhere, it's safe to assume that COVID-19 is in our community and has been here. So I wouldn't get too hung up in terms of the number of confirmed cases that we have, but it's important to realize that the common, easy things that you can do to prevent spread to loved ones or other people in the community, as Chris has mentioned, with hand washing, covering coughs and sneezes, those kinds of things that can really make a huge difference. Social distancing obviously is important with maintaining distance between each other. I know that seems unusual as we're used to being able to be around each other, but this will have to be the new norm for a while as we try to prevent spread of the illness. Because it will be much easier to prevent spread than it is to try to deal with people that may be potentially critically ill from the illness. Looking ahead, and not to sound alarmist, but the really important thing here is to plan ahead in terms of what would happen if you or other loved ones, particularly those that are at high risk, the elderly, those with heart and lung conditions, and other maybe serious underlying medical conditions that would put them at risk for becoming seriously or critically ill from COVID-19. To have a real discussion in terms of what we call in medicine advanced directives. This is not an easy topic to necessarily address, but it is nevertheless critical because if you or a loved one that has becomes ill from COVID-19 and is not able to make decisions for themselves, what would happen and what would that look like in terms of end of life or advanced directive for treatment? So there needs to be discussion, if you can, about those that you may know that may be at high risk. If you have parents or grandparents or even a spouse or others that you may know within your circle that may be at high risk for developing serious complications, to have a good discussion about what you would want for end-of-life treatment. Now, even in a normal setting, this is good practice. And even in a non-COVID universe that we can imagine that it would be important to have those discussions so that loved ones can make proper decisions in terms of treatment for those that become critically ill. So I think right now, because of the underlying issues with COVID-19, the pandemic it's causing, the amount of illness that it's causing, it's really important that we have serious discussions amongst our friends and family of how they would want to be treated in terms of advanced directives for healthcare should they become seriously ill. And so that sort of communication can be well known if in case they become ill and they can't make their own decisions. So please have those discussions amongst yourselves. Again, I don't mean this to be alarmist, but I do mean this to be in sort of preparation for potential things in the future. We don't, again, know how hard Jefferson County will be hit, but it's important to know how loved ones would wish to be treated in terms of becoming critically ill. Unfortunately, there's not an unlimited supply of ventilators and ICU staff and all those kinds of things, and you may have seen this in the media. And so even last night, I understand there was a discussion amongst doctors on Channel 13 about, there won't be enough for everything if this surges, and this will be far beyond the capacity of medical community to be able to deal with it. But if we can take the best measures that we can in order to prevent spread, but also in the event that people do become critically ill, that you've had discussions with them and that they might be able to make known their wishes of how they wish to be treated. But those are discussions you can have with your local provider. Those are not foreign in terms of things that they would deal with, and so I would encourage you strongly that you might be able to have those kinds of discussions so that you might be able to know how to press ahead in case you or a loved one has a critical illness. There is Bryan's been talking about getting tested, and some people are being asked, even in my own practice, why are they not being tested at that time for COVID and what sort of criteria there is. That criteria does change from time to time. In front of me, I have the sheet that we send up when we have the state hygienic lab, when we send samples up there for COVID-19, and they ask us specifically in terms of what sort of criteria they would meet in order to be tested. And I'll just read it off here directly. One is that you have a hospitalized patient of any age with fever and respiratory illness. Another is an older adult, which they define as greater than 60 years of age, with fever and respiratory symptoms, such as a cough, difficulty breathing, or chronic medical conditions, diabetes, heart disease, immunosuppressive medications, say if they're being treated for cancer, or other autoimmune problems, chronic lung disease or chronic kidney disease. A person of any age with any respiratory illness who lives in a congregate setting, and that just means that they live with other people closely, such as a long-term care facility, a dormitory, residential facilities, or correctional facilities, would be tested. And then finally, another they ask is a healthcare worker, essential services personnel, first responder, or critical infrastructure worker with fever, respiratory illness, such as a healthcare worker, fire, EMS, first responder, or people that work in, say, a nursing home, like a residential staff facility staff member. So there may be times that you are going to see if you need to be tested because you have, maybe you have a slight cough and some other things. You're worried that COVID-19 might be part of you might have it, and so you want to know if that's the case. You're being screened with this, as you understand from what Bryan's saying. There's not an unlimited amount of test kits, and so they have to prioritize in terms of what is going to be tested. And so the criteria that I just outlined is currently what the Iowa Department of Public Health is using for the state hygienic lab. If your doctor still feels strongly about testing you, as I understand it, you can still be tested, but it'd be through a private means rather than through the state hygienic lab. So it's not that you will be absolutely refused, but it's just to keep in mind that through the state hygienic lab, this is the criteria they want us to use to collect samples, and so they can be set up. And so that people can be tested properly using our resources effectively. Finally, if I might just throw this out there, we've had discussions about this before. Social media is great, and it's a great way for people to connect. But it can also be a way of disseminating misinformation. And so I would just plead with you to use social media responsibly. And please use it in a way that would be able to help others understand better what's going on. Putting up rumors and spreading other things that might be going around the community, gossip, etc., really doesn't forward any sort of cause within the community. Can only and really honestly causes problems in terms of causing the community to create fear and anxiety and panic that doesn't need to be have there. Please use social media responsibly. If you're going to share something, I would suggest highly using things from well-known sites such as the CDC or Iowa Department of Public Health and other trusted sources rather than anything that you might see as hearsay or otherwise. We will get through this, but this next couple of weeks will be very telling in terms of how things go. As far as the modeling as I've seen, about the third week of April is about when it's supposedly going to be a surge. But again, that can change from time to time. But the more we prepare and the more we try to engage in social distancing and other measures to prevent spread of the illness, we will do our best that we can and go forward. I'm grateful that we were able to work together. Again, you're very fortunate as a county to have a team that you have on board, and working also with the local county hospital and what they're doing and putting in place.
Great. Thank you, Dr. Trent. Are there any questions, most common questions that each of you get that you want to address?
I was watching the screen go up as well. I jotted down a couple things. I know when some of this first started circulating, some of the questions, et cetera, in the community, we were in the middle of influenza season. So some of the symptoms were similar. Well, now we're gearing up for allergy season because the grass is green, and I've already seen that some people have mowed their lawns. So again, if you're an individual that has seasonal allergies, you have to listen to your own body and your own symptoms and what's really going on internally with you. So if that is something that you usually experience, then try not to become so consumed with thinking that you have COVID-19. Think of it more appropriately like this is seasonal allergies going on. The other thing I jotted down was mental health. Mental health impacts all of us every day. And I know that it's difficult for people to be isolated, to be, to have your kids home all day long, to not be able to send your kids to daycare. Your routine is totally different from what it usually is. So I think all of us as humans really like routine. And I think if we could try to keep a routine, maybe a new normal, that would be helpful. I know it's difficult. I know that everybody's under a lot of stress, financial stress, concerns about kids, your own health and safety. Again, just try to limit your screen time, because sometimes it's easy to get, sucked into the Facebook doom and gloom. And like Dr. Trent said, and Bryan said, use appropriate resources. It is kind of depressing to watch the news daily. So just limit some of that time. It's nice to get outside. You can go for a walk. You can still be outside and do some social distancing. And just be kind to each other. This changes 2 or 3 times a day sometimes. What I'm telling you now at 12:15 might totally be different by 12:30. It depends if my phone goes off. It changes that quickly. We have webinars with Iowa Department of Public Health, and I think that as humans, we want it to be black or white. Healthcare is not black or white. It's really a lot of gray. It's a lot of all different colors, and we have to be understanding of that. What you might see in other states is not necessarily what you're going to see in Iowa, because again, it goes back to hot spots. It goes back to what New York looks like or what California is gearing up for. So be understanding that we might not have everything that every other state has, because we are different, because our state is unique as is all the other states. And just do what your employer is asking you to do. If your facility is currently closed, if you're on a short-term shutdown, if you're, trying to mitigate that spread. And the one thing that I'm going to close with for myself is please do not spread rumors, or don't try to figure out who the individual is that is positive with COVID-19, because we at the local health department know who that individual is. And you might think based on what's the rumors are circulating in the community. And again, I want to say that confirmed testing goes to the county of residence. So just because we have a lab confirmed case in Jefferson County means Jefferson County. That doesn't mean the city of Fairfield. That doesn't mean the little town of Batavia or Lockridge. It is Jefferson County as a whole. And I would ask people to be understanding of that. It's like any other communicable disease that we're dealing with at the county level.
Brett, do you have anything?
No, I see a lot of comments. I get questions from people. This not so much on a daily basis, but just to reiterate, it's sometimes get disappointing for us when we hear, well, no one's doing anything. They're not seeing huge tents being set up at the hospital. Visual things make people think that we're, I guess, doing something. And I can assure you that this team, everybody sitting here and many others out there are working daily on getting new information and getting information from the hospital and other places, the nursing homes, the care facilities on what they may need or what they need right now, and making sure that they understand what the new rules are and guidelines and things like that. So we are working every day on acquiring certain things, but just because we don't have a big National Guard tent set up at the hospital doesn't mean that we're not preparing for what could come. And like I said, some of the conversations we have in our meetings on a daily basis, went from kind of the process of getting the right communication out there, and that's what Chris and I and the team's been doing on a daily basis, and now it's moving into resource, and and then it'll move into recovery effort at that point. That's kind of how the processes go. So some of the conversations we have are worst case scenario, like I said, and no one wants to have those conversations, but we do plan for those in case it does happen. We'd rather be completely wrong and be prepared than be underprepared. So we are working, and there are things in place. I'd just like to say it. Now, there was a question up there. I'm going to turn it over one of these about should people be wearing masks in the grocery stores. So I'll let one of you speak to that.
Well, I could let Dr. Trent answer that.
Well, this is something that's been hotly debated and something that really, to understand really if it should or shouldn't happen, people that are ill should probably wear a mask. Okay, and also isolating themselves out of this, at home is really important. If you're sick and need to wear a mask and be home, if somebody else can help you get your groceries and do that, so you're not out in the public and exposing potentially other people, please do it. And so that might be something to be considered. And there's not like a clinical trial that's been going on right now. Should we wear a mask or should we not? There was an article that came out just yesterday about from the New England Journal of Medicine, about wearing masks. Masks can go either way. They can, in some ways they may be good in terms of there being a sign that there's something going on. It might help us keep our hands away from our faces. And that really may be the benefit of the mask rather than actually preventing spread, or protecting you from spread, I should say. Masks really serve an important purpose, particularly when healthcare providers are doing things that would be potentially invasive, such as intubating a patient so they can be potentially put on a ventilator. They need to be protected. They need to protect themselves. But in terms of going out in public and having to wear a mask, I don't think that debate's really been settled. But if you wish to wear a mask, there's no harm in doing that. But it just may be a good reminder to yourself and to those around you that there is something going on. It's challenging because we don't see this. This is not like like a war where you have soldiers and you can see the soldier in front of you or whatever. This is different. These are viruses, and so it's kind of the unseen enemy. And so sometimes wearing a mask sometimes can be beneficial, but particularly if you're ill and sick and in a room with other people that are otherwise healthy, it would probably be wise for you to be a mask. But in terms of going to the grocery store or whatever, if you are healthy condition, then wearing a mask I don't think is needed at this point.
Okay.
I just want to say this as well. Everyone at the health department's been working diligently, and I would not be able to do what I can do without the support of my team back at the office. And they run interference, they answer the phone, they take good care of us. And so I have to give a shout out to my team and to the Board of Health and Dr. Trent. I mean, he's been with us, like we said, he's talked to us every day for 3 or 4 weeks now, and everybody else in the room. I don't want to downplay anybody else's support because it's very, very important, but we would not be able to get through what we're getting through right now without the support of everybody that's right here up here as a group and all of our community partners, from little ladies that are in their 80s sewing masks to business and industry donating safety glasses to restaurants donating food. I mean, it's just a great outpouring, and that shows what our community really is all about. It's about taking care of each other. The one thing too, I just want to encourage people to do, if you have an older neighbor or somebody maybe that's housebound or somebody that struggles with getting out to get food, or maybe it's even taking their dog to the veterinarian or something like that, check on those folks. Offer something up to them and say, hey, can I help you in any way? I'll drop groceries at the curb or at your door, or I'll get you a bag of dog food, whatever it could be. I mean, there's so many things that we can do that we don't think about. And we just need to be nice to each other and understand that we have a lot of stressors. All of us do. We've all had to make sacrifices in our personal lives too. I am not traveling to see my grandson. I've had to cancel appointments myself. So it's not just that, Chris is like trying to enforce all these rules. No, these rules impact all of us on a daily basis. And I think that we need to remember that. Daryn, for the county, what would you like to?
Well, on a county level, we have closed our courthouse. Things are working well with doing that. There have been some cases of people not feeling like they are getting the service that they need, but Along with that, we did not close down what our secondary road department is doing. Our crews are still out there trying to maintain the roads and keep things moving so that we can keep commerce moving from out in the farms to the markets that they need to get their goods to. The Office of the Board supports our Sheriff's Department very greatly when it comes to wanting to emphasize that they need to wear their safety equipment when they go into any type of situation, whether that's an arrest or if that is someone that's called for an emergency service of some type. It's important for us to try to stay on top of that because, quite frankly, we don't have a second person in. This is not a game or anything like that. If one of our critical people goes down, we have some problems that we will have to face when and if that comes. And so we are trying to stay positive with what we're doing. We're trying to keep our sheriff's officials and the jail as safe as possible, particularly the jail with its population and the expense that goes along with what goes on with this disease. That is borne by the county when it comes to an inmate. So one big question that I face quite a little bit is the expense of testing. Is that borne by the person being tested, or is that done on a free basis at this point in time?
So to answer that, I don't know if you want to jump in, Bryan, but if it's done through the state hygienic lab, my understanding the state is bearing that cost. Mm-hmm. If you do not necessarily get tested through the state, then it would be billed probably through their insurance. Okay. And when I was meeting with the Jefferson County Hospital 2 or 3 weeks ago, Curtis was mentioning that it was around $51 or something. They weren't going to charge any more than what they were going to bill Medicare. Does that sound right?
Yep, that's correct.
Okay, there has been a lot of questions concerning that. I know that people are concerned that testing is only for people that can afford it and not for the general population of our county. I've tried to say that that is not the case, that only people that can afford to have the tests are given them, and trying to dispel that. So that is why I have asked this question today.
Yeah, I think it's important to know that, again, the state has made it so that they will pay for it, especially if you meet the criteria that I had outlined earlier about that. And so the state is doing their part in terms of trying to alleviate the burden of cost for that. If you do have insurance and your provider still feels that maybe you don't meet any of those particular criteria and would go outside of the state hygienic lab, they certainly can still test you. But it would be through a private company. I think it's up in Coralville, LabCorp, I think is who the hospital is using. And they can charge it through your insurance. But again, they are not, this isn't going to be a test that's going to cost you $1,000 or $500. As far as I understand it, they're only going to charge what they would charge Medicare, and it's going to be pretty reasonable. I think it's around $51. So if you feel like, or your provider feels like they need to test you, they still have that opportunity. It's just the state won't be the one covering that cost per se.
Okay, thank you. That helps clear that up quite a little bit.
Yeah.
And again, it goes back to us as humans wanting to know a test result or to be tested. And as we know, it's just a snapshot in time. I can't stress this enough. That doesn't mean that you're not going to end up having symptoms later, or you might not ever develop symptoms. I understand people want to be tested because that's how we are as humans. We want validation, yes or no. But I just want to stress that if you're symptomatic, we're going to treat you based on your symptoms as a nurse, as a physician, based on your symptoms, and develop a treatment plan accordingly. But I do understand that, Daryn. I do. It's just we're so used to instant tests like a rapid strep test or other tests that you can find immediately the result, and that's not the way this is. So, yet.
And I would just jump in and reiterate that our providers, our physicians, and our nurse practitioners who are seeing these patients, I guarantee they are not evaluating whether they have money to pay or not. It is based on criteria and how sick they are, and do they meet the criteria for testing, or other things that they may be seeing that's been mentioned. So,
Thank you.
Yeah.
Bryan, do you have anything else to add?
No, a lot of questions that we get are regarding testing, and I think we've touched on that enough. But I would reiterate that we also, in our team that is focused on COVID and addressing this, is easily spending 80 to 100% of their time just on following the guidelines and updates for COVID and making sure that we're responding appropriately. So we are definitely behind the scenes, continuing ongoing monitoring of everything.
Great, thank you. I'm sorry, I'm not able to read all of the comments and our questions. My eyes aren't that good. That's why I tried to get on earlier to see if I could see them. And we don't have enough time really to answer all your questions. So if you've got additional questions, go ahead and email one of us. You can email me here at the mayor's office. We'll get you the answer. And just as I think in closing, one of the things that people have asked me is why is there no shelter in place in Fairfield? I legally do not have the ability to call a shelter in place. That comes from the governor's office. However, and I know there's a debate, it's been frustrating, I think, for some people. Some people want there to be a shelter in place. Maybe from the business side, they don't want that. Here's, from my perspective, she has put out a lot of things to keep us sheltered in place. And we as adults, let's do the right thing. We know what the right thing is. The right thing to get this to not spread is to stay at home as much as possible. If you have to go to work, some people do. If you can work from home, do it. Keep your kids at home as much as possible, not playing with their friends, even though I know that's hard for them. And again, when you're out, even with friends, you're taking a walk in one of our parks, great. It's a good thing to do. It's good for our mental health. It's good for our physical health. But again, also stay your distance. So if you don't know that somehow you've been gotten this virus and you're not showing any symptoms, at least hopefully you won't pass it on to somebody else. So again, even though we don't have a shelter in place, let's do our best that we can to do that. And that, again, will help all these people because we don't want them to be overrun all at once with a situation we can't handle. Appreciate the fact of going to trusted sources to get your information. And particularly for those people that are isolated at home all the time, if you need help, call someone. I don't care if you leave a message on my phone here at the mayor's office. I'll get you help. For people who need help, the elderly that are by themselves, even if you're feeling isolated and frightened and scared, call someone and we'll get you help. I want to say to the ladies or men, anybody who is making face masks, continue to do so and get them up to Chris or at the hospital and they will distribute them to the right place. So continue to do that. I wanted to make a shout out to Wheaton Capital and Sky Factory because Wheaton Capital is making face shields or is going to be making face shields. So we really appreciate our local businesses coming to the rescue, so to speak, to really help. Sky Factory also is doing some things. Public health phone number is 472-5929. Chris and her team are ready to take your calls, your questions, so you can call them. And again, the COVID hotline locally at our local hospital is 469-4180. Again, that's 469-4180. There are people there to answer your questions locally. So please reach out to those numbers if you have additional questions. Again, email one of us. We'll try to get you the question that you need answered, even though we couldn't answer all of these questions today that have come up on the screen. Thank you very much, and thank you for these people that are working really hard behind the scenes. And when the public is needed for a particular thing, we're going to let you know. I know some of them feel like you want to help, and it's greatly appreciated. And when the time has come that we need bodies or we need a particular thing, believe me, this team is going to put it out there and let you know what's needed. So thank you again, Chris, Brett, Bryan, Dr. Trent, Daryn, thank you for coming. And thanks to Jason and Fairfield Media for making this happen. We couldn't do it without you. So stay well, everybody, and be safe. Thank you.